Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And Janice and I are about to start teaching day one of the Integrative Corrective Exercise Instructor program. And day one of this 3-day intensive program, the Introduction to the Integrative Movement System, is all about training the core and especially addressing specific issues around disc issues and your clients that have osteoarthritic changes, including spinal stenosis. And that's why we're sharing this information with you in this special 4-part series of Integrative Movement Insider. Because so many of your clients will present to you with chronic low back tension and or discomfort and or the inability to do the things that they need to and or want to. Or maybe they can't perform at the levels they once did because of chronic disc issues and or issues with spinal stenosis, I should say. So what happens is, these clients go to physical therapy or they go on the internet and get exercises. And they start to do exercises and they're just kind of randomly doing exercises, but they don't really have a strategic approach about addressing their disc and or spinal stenosis issues. So that's why this information is so important to you as a health and fitness professional, because they're going to turn to you and you want to provide your clients with the most effective strategies for improving their spinal health and helping them develop more optimal and efficient strategies. And that's really what this whole approach is about. It's about helping your client identify their non-optimal and inefficient strategies that are leading to chronic disc problems or chronic osteoarthritic changes or spinal stenosis type changes. And if your client is presenting with these issues, giving you the tools and the approach to help your client create their most optimal and their most efficient strategy. So again, thank you for joining us in this series. Now, in part one of the series, I discussed the difference between disc and spinal stenosis type issues. Now, frequently, your client can present with very similar symptoms, whether they have disc problems and or spinal stenosis. So if you missed that video, watch that one first, because this information develops directly upon that information that I shared with you in part one. Now today, I want to discuss a very common corrective exercise or position for clients that have spinal stenosis, and why they shouldn't use this type of position if they have spinal stenosis. And that's the Cobra position or the McKenzie position. Now this position is generally used for clients that have disc problems. However, for your clients that have spinal stenosis, remember we talked in part one that a lot of your clients with spinal stenosis, they're stuck in this posterior pelvic tilt and lumbar spine flex position because that creates more space in the spinal cord as well as the spaces where the nerves are coming out. So if we're trying to bring our client into a more elongated position or spinal extension, that can actually create more compression and more issues with the spinal cord and or nerve roots and create more discomfort and or symptoms down your client's legs if they have spinal stenosis. And it can be very appropriate for clients, the Cobra type position or McKenzie type exercise where the client is going to extension can be very appropriate for clients that have disc issues. So I'm going to share with you how we modify the Cobra or McKenzie type exercise for your clients that have disc issues. And it also helps your client with spinal stenosis. Now, not every client with spinal stenosis can be in this position. So oftentimes we can help our clients get into this position by helping them develop a more optimal strategy. And the strategy we're really trying to help them create is better alignment of the rib cage over top of their pelvis. So you want to do your soft tissue release. So release around spinal erectors and thoracolumbar fascia. Release around the posterior hip, the glutes, the posterior external hip rotators that pull the spine and pelvis into, pull the pelvis into posterior pelvic tilt and the spine into lumbar spine flexion. And then we want to help our clients create more length. We need more length through their spine, and we like this position, prone and lengthening, which is a modification of a child development position, and it's a modification of the Cobra position or McKenzie position. What we're trying to do with this position, or what we're looking to accomplish with this position, is to create spinal length before we go into extension. Because many of our clients that go into spinal extension, they're just creating hinges, like I'm doing right here. I'm just hinging at my thoracolumbar junction and over compressing my lumbar spine. So we want to help our clients create more optimal stacking of the thoracopelvic cylinder. So we probably start out with happy baby position if our clients tolerate that position. So on the back, rib cage and pelvis stacked up. Because then we want to take them into a prone position and teach them how to elongate as they go into extension, because our clients need to extend. I mean, they're going to reach up over their overhead to get something out of their cabinet and or to lift overhead in the gym. So we want to teach them how to stack and align, but then create length before they're going into extension so they stay out of the hyperextended type positions. So prone lengthening position is a great way to do that. What you'll notice is the first thing I do is how I set myself up. I'm going to put my hands in this position because this will also improve the shoulder position, but we'll talk about that in a separate video. What we want to do is feel like as if our client is pulling the floor apart between their hands and pulling themselves forward. So you'll see me pull my hands apart on the floor and pull myself forward to create that length, because the scapular stabilizers are also spinal elongators, not extenders, but elongators. They'll help you elongate, or your client elongate their spine as they're pulling. So I'm going to step up here, or lie up here on this desk here, so that way you can see what this pattern looks like. So I place myself here, hands go underneath the shoulders, and I want to feel as if my head is looking straight down. So keep my head looking straight down, pulling long first. So pull long first, breathe into this position before you ever have your clients lift up, because you want to focus them on getting long through the back of their head, that direction. They're pulling themselves long, they're breathing into their low back, their abdomen, into their pelvic floor, breathing 3 to 5 breaths, and just focus on creating length, that direction, as if they're pulling themselves on the floor, that direction, not just trying to jam themselves into extension. So 3 to 5 breaths. Keep focusing on the length going that direction. As long as there's no discomfort, you may have your clients on a second set of 3 to 5 breaths start to raise up a little bit higher, but the goal is always to keep the pelvis down, glutes relaxed, and to keep lengthening that direction. So that way, you're focusing on your client on creating that length as they move into that lengthening type position. So that way the breath is helping to create that lift that we want. Because ultimately, we want our clients, whether they're in that spinal stenotic posture or they're in a disc type position, which is often also posterior pelvic tilt and lumbar spine flexion, we want them to create more stacking and alignment of the rib cage over the top of the pelvis, and then to be able to create that length this direction, to lift them up off their low back. That's what you do with alignment, breathing, and control, and why these principles are so important, because you're helping your client align, breathe, control, to stack, and then create length and lift that direction, or what we refer to as suspension. So the prone lengthening position that I just demonstrated is a great way to teach spinal elongation and that idea of suspension, so clients aren't just compressing down into their low back, which creates and perpetuates disc problems as well as spinal stenosis issues. So I know it's quite a bit in this video, but I hope you enjoyed it and helped explain why we don't do Cobras or McKenzies right away with our clients, and how we use that position, the modified child position, child development position, what we refer to as prone lengthening, to create more stacking and alignment, to create more elongation, and how that transfers to the upright position, because ultimately we need our clients to transfer this into the upright position. So next week I'll come back and demonstrate how we take this position into the upright position to start to load the core and help our clients develop their most optimal and their most efficient strategy, so you become the go-to expert for your current clients with disc and or spinal stenosis issues, as well as attract more individuals that need, want, and will pay you for your expertise. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, and we'll be bringing you updates throughout the weekend about this program, the Integrative Corrective Exercise Instructor Program. And I see my good friend and colleague, industry colleague, Jackie is watching. She's been through this program several times. She sent her trainer through this program as well, and she trains the older clients and does a great job incorporating this information into her small group training as well as her one-on-one clients. And she's a great friend, and she's really a testament to using this information and really applying this information to her clientele and really carving out that niche. And what we're also helping to create through these programs is an additional stream of clients for you, referrals from healthcare practitioners like chiropractic physicians, like physical therapists, like massage therapists, and medical doctors that need experts just like you to refer their clients to. And Jackie's doing a great job down there in Houston, Texas. And thank you so much for all you do, Jackie, and for being part of our program. And we look forward to seeing you at future programs as well. So we'll share updates with you throughout the weekend. Thanks for watching. Make it a great day. We'll see you throughout the weekend, and also in part 3, which will come back with you probably next Monday, because we're traveling on the road here. Make it a great weekend. It's Dr. Evan Osar. We'll see you later. Bye-bye.